China has said that an outbreak of an unknown viral pneumonia.
The governor declaring a state of emergency. The first death from coronavirus here in the United States.
The coronavirus is the biggest threat this country has faced for decades.
आज रात 12 बजे से घरों से बाहर निकलने पर पूरी तरह पाबंदी लगाई जा रही है.
Today, we are unraveling the 5-year saga of COVID-19 variants, from Alpha 1 to NB 1.8.1, and their massive impact on global health and economies. How did these tiny genetic changes in a virus shake the world? Stick around as we break it down with key data, visuals, and insights you won't want to miss. Let's get started. Let's start at the beginning. In December 2019, a mysterious virus emerged in Wuhan, China, linked to the Hunan seafood market. By March 2020, the World Health Organization declared COVID-19 a global pandemic. But this wasn't just one virus. It kept evolving, spawning variants that changed the game. To track these, the WHO created a system to classify them as variants of concerns and variants of interest. First up, the Alpha variant, or B1.1.7, hit the UK in September 2020. It was 30 to 50% more transmissible than the original virus, spreading like wildfire. In the UK, hospitals were overwhelmed, struggling to balance COVID and non-COVID care. Temporary field hospitals, they didn't help much. There just weren't enough trained staff. Next, the Beta variant, or B1.351, emerged in South Africa by May 2020. This one was 50% more transmissible and had the highest death rate of any variant, 4.19%. It drove South Africa's second wave, with healthcare workers battling long-term symptoms. In Canada, Beta spread overlapped with a second wave that led to 3 million job losses by April 2020. National output dropped 17% below pre-pandemic levels. Governments scrambled with emergency support, but the damage was done. Then came Gamma, or P.1. First spotted in Brazil via travelers in Japan in November 2020, it was 1.4 times to 2.2 times more transmissible and could evade immunity, causing reinfections. In Manaus, Brazil, hospitals saw a 97.9% hospitalization rate in some areas, with ICUs overwhelmed. Then came the Delta variant, B.1.617.2, detected in India in October 2020, became the global dominator, reaching 179 countries. It was 60% more transmissible than Alpha, with an 85% higher hospitalization risk and 137% higher mortality. In the US, 23% of patients needed ICU care during Delta's peak, and children's hospitals ran out of bed. Delta didn't just strain hospitals, it choked global supply chains. Factory closures in Asia led to shortages of semiconductors and skyrocketing shipping costs. Inflation risks loomed large as economies struggled to reopen. Enter Omicron. First reported in South Africa in November 2021 with a ton of mutations. It was insanely transmissible but less severe, with a 57% lower hospitalization risk and 63% lower mortality than Delta. Still, its sheer volume overwhelmed hospitals. 32% of US ICU beds were for COVID patients at its peak. Omicron's economic hit was brutal. China's zero-COVID policies caused mass lockdowns, disrupting global supply chains again. Asia's GDP dropped by 1.6 percentage points and global growth forecasts were slashed. By 2023, Omicron's subvariant JN.1 took over, becoming dominant in 70 to 90% of cases globally. By February 2024, it spread fast but caused milder symptoms, signaling a shift towards COVID becoming endemic. In 2024 and 25, new variants like KP.3, LP.8.1 and NB1.8.1 kept emerging, with NB 1.8.1 showing mutations that might dodge antibodies. So what had we learned? COVID-19's variants showed us how a virus can evolve and disrupt everything. Healthcare, economies, even our daily lives. From Alpha's spread to Omicron's waves, and now NB1.8.1's mutations. The past 5 years have been a roller coaster. The key takeaway? We need global surveillance, equitable vaccines, and adaptive strategies to stay ahead. Thanks for watching Prism Bharat. Drop a comment, what do you think the next chapter of this virus will look like? Stay curious and we'll see you in the next one.